certainly can. You got my email? Or do you have it on flash drive?
Hello?
I guess you want to put him out into the speakers, house speakers or board, whichever.
Hello,
Testing to see who's on the call. This is Mike Emery.
I'm here, Mike.
I think, Brock, are you there?
I am.
You got my email? Or do you have it on flash drive?
My check 1, 2. My check.
Hello?
Check 1, 2. I guess you want to put him out into the speakers, house speakers or board, whichever.
Hello,
Testing to see who's on the call. This is Mike Emery.
I'm here, Mike.
I think, Brock, are you there?
I am.
My check 1, 2. My check.
Hello?
Check 1, 2. I guess you want to put him out into the speakers, house speakers or board, whichever.
Hello,
Testing to see who's on the call. This is Mike Emery.
I'm here, Mike.
I think, Brock, are you there?
I am.
Hey, Mike. That worked good too, because I can hear what you just did.
Phone conference, check. Check 1, 2, phone conference. Can you hear me?
Testing 1, 2, 3. I can hear you from Greenville Utilities. Can you hear me?
I can hear you.
Awesome. I'm going to mute again.
Okay, I'm gonna let Kyle know. Thank you.
Cool. Thanks.
Thank you all for coming. This is media session number 5 of the Pitt County COVID-19 media sessions. I do want to say we are trying some new things on this one. We're offering now video call-ins via Zoom. We are also offering some phone call-ins as well. So we will have some presenters who are participating via video call, which will bring them up on the monitor when they're ready. And we also have some presenters who are available, our partners rather, who are available via a phone call. So if they have anything to say, they will be there as well. I know right now, I think we have the city of Greenville via video call and Greenville Utilities via phone call. So if there are any questions posed for any of those entities when we get into our questions, they are available as well. Additionally, we also have Pitt County Schools here, Pitt County Emergency Management, Vidant, Pitt Community College, and if there are any others, I will announce those as we go. So we're going to start right off with Dr. Silvernail and his opening statements.
Good morning. First, let me express my sincere wishes to all who are battling COVID-19 infection for a speedy recovery. Our thoughts and prayers are with you. Yes, we have seen growth in our case counts since last week. This does not mean that our actions are not working, as most, if not all, of these new positive tests were collected before our #GoHomeStayHome campaign. We did receive a clump or batch of tests yesterday that added to our total case count, and I'll go through those numbers in a bit. Please continue to practice social distancing and good hygiene habits. Doing this will help you all avoid COVID-19 infection. Especially want to thank the citizens and also our businesses. I think folks have been really doing a great job of following our guidelines. There are some exceptions. We've had some reports of exceptions, but in general, people are doing a great job with this. We know that staying home can be tough. Being cooped up with your kids can be tough. Please consider looking at our positive parenting program. also known as Triple P, for help through these times and anytime you need help with parenting challenges. Some Triple P highlights include: reassure your children that your family is your top activity. Maintain everyday family routines. Have plenty of interesting things to do at home. Be truthful in answering your children's questions. Let's move on to the case counts. Currently in North Carolina, there are 1,498 cases of COVID-19. In Pitt County, we have 26. I will mention the state website is showing 27 for the county. In our investigation, we determined that one of those cases is a Martin County resident and have attributed that case to Martin County. So we are not showing that in our case counts this morning. In North Carolina, there have been 8 deaths. In Pitt County, we have no reported deaths from COVID-19 at this time. Testing numbers. In total, we are aware of 259 patient tests being done in Pitt County. This number will become inaccurate and will probably not be reported in the future, as the state has discontinued what we call the patient under investigation form. So we will not be aware of everyone who is tested. At this time, we have 26 positive results in Pitt County. We've had 120 negative results in the county. At this time, we have 113 test results shown as positive, or shown as pending, excuse me. We know some individuals have recovered, but this is a difficult number to track and report, as these individuals are not under the direct care of Pitt County Health Department. Finally, please remember to go home, stay home. Thank you.
Good morning. I'm Brian Floyd with Vidant Health. I just want to start off and thank you again for your continued support. The community has showed up incredibly well to support Vidant Health and our teams. And we feel that, and we are so very grateful for all the manner in which you're doing that. It's easy to, over time, appreciate the significance of this COVID virus. The realities are, as you just heard, the cases are increasing in North Carolina, they are increasing in the United States, and they are increasing in Eastern North Carolina. There is exponential growth as we projected. Frequently, we're asked about this in comparison to the flu, and this is a more serious virus than the seasonal flu. While it may be contracted and things in the same manner, it has a deeper consequence to patients, particularly those who are critical ill. So it's important that we understand the seasonal flu on average would infect 1 to 2 people. With COVID, we are seeing the number be a little over 3. So its spread rate is faster and it has a more severe consequence, particularly in the elderly and more vulnerable populations. We are predicting the peak demand for this in North Carolina to continue to be in mid-April. The 20th to the 25th is what our projections are showing. In Eastern North Carolina, a little bit later, at the end of April and into the 1st of May, are the latest models we have for the peak of this virus. So we still have limited testing capability, as you heard earlier, both at the state level and locally. So some underreporting of results is to be expected in that window. So we just need to be cautious to recognize that there is more case than you hear the number of because of slow testing capabilities across the region. So we keep stressing social distancing. We do see areas where we're not doing that as well as we need to be. And so from the health system's perspective, we are asking for the public support and helping make sure we have the capacity to handle what could be extreme numbers. Now is the time to practice the behaviors of social distancing, washing your hands. If you're concerned about symptoms, wear a mask. So just be very careful with that issue as we continue in the days forward. Again, very, very proud of the team at Vidant Health. Tremendous amount of work to be sure that we are prepared and we continue those preparedness activities. And I couldn't be more proud of our team and this community for its great support during this time. Thank you.
On Monday, Pitt Community College administrators learned that a PCC employee had tested positive for COVID-19. In response, we conducted a thorough review of security camera footage to determine who could be considered high risk and exposure to the virus as a result of close contact with the employee for a prolonged period of time. Per CDC guidelines, we have made direct contact with every high-risk employee and asked those individuals to adhere to isolation protocols. We're thankful that several precautionary measures on campus help to mitigate the spread of COVID-19 to keep the number of potential exposures to a minimum. Many employees are working remotely, campus access has been restricted, and facility services personnel are practicing increased sanitization processes, which include the cleaning of touch surfaces multiple times a day. PCC is one of the largest community colleges in the North Carolina system, but we're a tight-knit campus, and this has hit very close to home for many of us. The employee who tested positive for coronavirus has been following the guidelines for reducing exposure to the virus, yet they still contracted it. My understanding is that the employee is doing well. We're extremely grateful for that. We're praying for a speedy recovery and sending positive thoughts to our fellow Bulldog and the individual's family members. Due to privacy laws, we cannot discuss any further information about this case. We have a long road ahead of us, and it is paramount that we remain diligent in keeping the safety of ourselves, our loved ones, and our community at the forefront of our actions. PCC is still encouraging employees to practice social distancing and increased hygiene practices. In closing, I would like to emphasize that no students were exposed to the coronavirus, and very few employees were deemed to be at risk for exposure as a result of close contact for an extended period of time. Finally, I would like to ensure all of our students that Pitt Community College is dedicated to them continuing the progression towards the completion of their coursework. Thank you.
Okay, those are all of the prepared remarks we have for today. We're going to go ahead and get into a question and answer. I would remind the reporters present in person to use the microphone when you're addressing for questions. Also, if there's anyone who is any partners who have joined us via Zoom or our phone in, if there are any questions asked of you, please be available for that as well. So I think we're going to start with any questions for Dr. Silvernail, and then we'll go down the line from there.
Hello, can you hear me?
Yes,
Yep, sorry.
Oh, sorry. Hi, this is Nikki with WITN. Am I allowed to ask some questions now?
I can't quite hear her, Mike.
Can you hear me?
He's going to turn it up so I can hear you better.
Okay.
Okay, try to ask it again, please.
All right, how am I sounding now?
I'm still, Mike, I'm still not hearing her.
Should I speak louder?
That's better.
Okay, I'll speak slowly. People at home who are starting to stay at home because of the order are wondering if this is going to go further than 30 days. Do you see people realistically staying at home longer than 30 days, maybe a couple of months?
I think we need to look at this in terms of incubation cycles, and those are really 2 weeks. Right now, the president is suggesting that we continue this through the end of April. So that would be 4 weeks or 2 incubation cycles. We may very well need to go longer. It's hard to say for sure at this time.
And this might be a good follow-up question to that, but the governor of Virginia extended their stay-at-home order until June 10th. Is there any discussion among county leaders or maybe city leaders about something like that?
Not to my knowledge. I know we put 2 weeks on the initial order and said that it would be reevaluated at that time.
Is it possible for,
Mike's, sounds like your mics are dead. Oh, you muted them. Okay.
oh, okay, cool. Sorry. Is it possible for us to get another breakdown of the distribution of cases by age or severity?
I can give you a range roughly. And I think the youngest person we've had was 17. The oldest person that I'm aware of is 72. And other than that, I don't have more demographics at this time. I'm just sorry I don't.
Okay, that's fine. And in your opening statements, you mentioned that there were a couple of essential businesses that the public had some concerns about, had reached out to you all. I spoke with Chief Holtzman yesterday, and he said that that's also something that they're watching, that it's not necessarily the public that's the issue. It's these essential businesses that are having trouble instituting those social distancing practices within their businesses. Any comment on that, or any advice for those essential businesses on how to maintain social distancing?
I would encourage them all to look at the guidelines and try to make sure that folks maintain their spacing in those businesses. They're essential, so they can't be closed. They must remain open. We'd also ask people to use their best judgment as to how can I safely enter that business, get what I need, and leave without coming too close to someone who might be sick.
And those exceptions that you mentioned when you were giving your statement, were they grocery stores? What kind of businesses were they?
I don't want to mention them by name. One was a big box store that seemed to have a lot of people in it. And then someone else told me that they, when they went there, they had marks on the floor to keep people apart in the checkout line and things like that. So I will tell you, even the Little Simpson post office had red X's on the floor as to how far apart to stand waiting at the Simpson post office. So like I said, folks are trying to do a good job, and it's really important because we could potentially be overwhelmed. We don't know yet.
I'll let somebody else chime in.
So are there any cases in Pitt County related to community spread yet?
We believe so. The first dozen were probably all had to travel history. The next group of cases does not seem to have that same travel history in
Okay.
general.
So
There were some that did, but not all of them.
so how many cases would you say were related to community spread?
Of that next dozen cases, maybe 8 out of the next 12 cases were probably community spread,
Okay.
just
And
as a guess.
okay. And what are the professions of the patients that?
We don't record occupation for all of those. We know where some of those folks have worked, and we do some limited contact tracing with those folks. And many folks, and this is another thing where our community's been great, if somebody was ill in the work environment, they have notified their employer, and their employer has done notification to folks that may have had contact with that individual. So they've actually done some of that contact tracing for us already.
And were any of the patients exposed to large groups of people?
Not that we're aware of, no.
Okay. And how many patients are currently hospitalized?
I would defer to Mr. Floyd for that question
Okay.
as the Vidant rep.
So are there any predictions right now of how many patients might die of coronavirus in Pitt County?
That's a hard one. I've calculated that a couple of different ways. Numbers can, if you do it one way, are very low. Numbers on the other end can be very high. So we're not sure
Okay.
at this point. I know Vidant has done some modeling, and you may want to ask him of what his models have shown.
What are the two different ways of looking at that?
It comes down to how you calculate what's called an attack rate. So that's a number that tells you how many people in a population are likely to get ill. And then we would look at that group of folks who would get ill, and then we know that about 80% of them are going to be okay. 15% of that number are going to have a more severe illness, maybe needing medical care or even hospitalization. And then about 5% of that number are going to need critical care in terms of ICU level care. The hard part about calculating mortality is that the mortality rate's been all over the place. And I didn't bring the slide with me this morning. Maybe we'll put that up on Thursday and show you that when these things present, it's kind of like a pyramid under the water. And we see the top of the pyramid first, and that's the deaths. And then we see folks that are hospitalized. And then we see folks that are sick enough to need medical care in the community. And then there's a broad base of folks that have mildly symptomatic disease to maybe even asymptomatic disease. So the denominator that we use to calculate those rates is unknown. And often, excuse me, often early on in an epidemic, we overestimate the case fatality rate because the denominator is underestimated. The true number of people who got the infection is underestimated. I know that's a lot to try to put into a sound date.
Almost like an iceberg.
Yeah, so if you think about it, exactly, an iceberg or a pyramid, and we only see the very tip of that at the beginning. So the numbers initially look very frightening, and as time goes by, they tend to look a little bit better. That's not to underestimate that we're going to have a significant amount of folks get sick, and perhaps a significant amount of folks expire or die from this infection as well. Okay.
And Dr. Silvernail, Nikki with WITN again, looking into the future as we have been, how many cases do you see in the future as it's being projected right now? Obviously you can't predict exactly what it's going to be, but do you see this as the way it's going right now, Pitt County getting into the hundreds?
Oh, absolutely. Yeah, I would.
Mhm.
A total case count when this is all said and done is hard to predict, but I think our total burden of disease will ultimately be above 100 if that's kind of the break point right now, and perhaps
And
higher.
do you see it going farther than that? I mean, a couple hundred, or it's hard to say?
Hard to say. I've calculated this a couple different ways, and I've got numbers from a few hundred to maybe pushing 1,000 or more folks in different modeling and different calculations for
Okay.
that. So again, there's a lot of assumptions in those that may or may not be correct. But I think we should prepare for a large number of ill people, both in the community and in our healthcare system.
Definitely. And I know everybody, the city, county has been pushing social distancing, but a model that the White House cited actually says that over 80,000 people could die by August if measures aren't taken, even with social distancing. With that in mind, do you have a response to that, or is there anything else that individuals could be doing other than social distancing?
Well, unfortunately, we don't have any countermeasure for this right now. We have no vaccine. We don't have any medicine that we can give someone to prevent this infection. I know there's been a lot of talk about hydroxychloroquine and are folks on that medicine perhaps more resistant to the virus. Those are observational studies. There may be something to it, but there's not enough information for the CDC to recommend that be more broadly given in the community.
Okay, and last question for you. The stay-at-home order is in place. So many people are staying home for who knows how long, 2 weeks for sure. But do you have any advice for staying home for that long? A lot of people are not used to this.
Well, like I say, for parenting, you can reach our Triple P parenting program. Has some suggestions for dealing with children. We've seen some things that are very creative of folks doing activities with their kids out on their own property, of course. I think if you have a hobby or something you enjoy, it's a good time to reconnect with that and spend some time with that. I'm happy to report that over the weekend I got to spend some quality time with my John Deere and got my yard mowed. So that was a good stress reliever for me. But I think everybody's got to find what works for them. And there's some activity that you enjoy that you should be able to participate in during this time to help take your mind away from things.
All right.
Got it. Thank you.
Dr. Silvernail, Tyler, Channel 12. As far as getting those test results back, are you still seeing several days to get the test results back, or have you heard of any kind of rapid testing? I know yesterday announced 15-minute test.
Mm-hmm. There's the lag time with most of the tests that are reported to us, Tyler. And again, from a reporting standpoint, we're the aggregator of this data. So the physicians report to us, the labs report into the state system. They come to us from a couple of different directions, and then we're the aggregator of this data. Typically from the commercial labs, we're 3 to 7 days for results from a commercial lab. Abbott did, and I'm not mentioning them as a trade name, but Abbott did release the COVID-19 test on their ID Now platform. Over the weekend, there was a press announcement about that, and that is what has been talked about as a positive results in as little as 5 minutes on that platform. And that could be a game changer if people can get that platform and get the cartridges to go with it.
And I know with kind of the testing side of things, a lot of people from what I've heard, not necessarily even here in Eastern North Carolina, but around the country, or if they are younger and do show those mild symptoms, they may just say stay home and not get tested. What are your thoughts on that?
That is the current recommendation, Tyler, that if you're mildly ill, to stay home until you're well, which generally means at least 7 days from the onset of infection. and probably for most people 14 days from the onset of infection. And that if you're not sick enough to need more aggressive medical care, that you don't necessarily need to be tested. One of the things in terms of figuring out the base of that pyramid on the backside of this will be to do what's called serosurveillance and look for antibodies in the population at large to get an idea of how many folks had the infection and were mildly affected by it.
And what would be, I guess, the threshold or when you would say to someone, hey, you should go in, you should get a test?
If they're having trouble breathing, if they have chest pain, if very high fever, if they're not improving at all, sort of what a prudent lay person would use as a reason. Again, we encourage people to call their physician first. Sometimes folks can be managed at home. If it's a true emergency, then yes, they should call 911 and seek care urgently. But we really want them to try to have that conversation with their physician when they're diagnosed, and to check in periodically with their physician, or their physician should be checking periodically with them so that they can be monitored at home.
In regards to the individuals who have recovered, is there a total number of people here in Pitt County who have recovered from the COVID-19?
I don't have that number for you, Tyler. We know that some of the folks, when we've called them to do their case evaluation, they have already felt better. We had one individual who had tested positive and had almost no symptoms and was already better when we called him. So I would guess that at least 3 or 4 folks that we know of already. And again, it's kind of hard with the tests being lagged so well, so far behind, and to report that number.
What are the age ranges of those folks who are feeling better now?
Most of those were on the younger end of the spectrum, although we do have some middle-aged folks as well.
And then the Martin County, so it was a Martin County resident. Did they get tested here in Pitt County, or what was the situation?
They were tested here at a Pitt County facility. And again, that goes, public health reporting is done on basis of county residents. And she was originally tested here and thought to be a Pitt County resident. As we've looked at this, her addresses, her voter registration come back to a Martin County address. So we believe that she is a Martin County resident. So there may be some give and take on some of these folks. Last week, we had 2 people with 2 different Eastern North Carolina addresses, a Pitt County address and then an address in another county. So it's really a question of which is their county of legal residence as to the reporting part of it. So there's a little bit of a give and take with those until we figure that out.
Gotcha. And yesterday, the White House mentioned, or a potential recommendation of every American wearing a mask. What are your thoughts on that? And do you see that being possible down the road?
I know the White House put that out. The CDC, the Surgeon General, was still saying no for the general public on the news this morning. In most cases, it probably offers little or no protection to you unless you're interacting with a sick person that you know, somebody who is sick. So would I wear a mask to go to Walmart or go to the grocery store? I personally would not.
And just for the viewers at home, can you kind of break down what's the difference of the N95 versus like one of the general masks that you would wear walking around?
Yeah, a surgical mask is meant to catch droplets, which are larger airborne particles. They're considered in suspension, and they tend to fall out of the air pretty quickly, usually within about 4 feet of that person. N95s filter about 95% of particulates, so they filter smaller size particles. Things like viruses. And then with infections where there's what we call aerosol or airborne spread, they can stop the person from breathing in that airborne spread or aerosol of the organism.
Gotcha. All right. Thank you.
This might not be, or I guess I'm not sure who the best person to answer this question is, but we've gotten a lot of viewers reaching out to us about correctional facilities and jails and cases within those facilities. Are there any operational changes or policy changes within those facilities that you're aware of to try and stop the spread of COVID-19 within those places?
Major Phillips was here and addressed that last week in one of his comments. I know our Pitt County Detention Center is cohorting inmates and screening inmates coming in. We provided them with test kits so that if they needed to test an inmate in their in-house medical program, they could collect a sample and send that to the state lab. So I know Pitt County Detention Center is doing that. I can't speak for the state detention system.
But so far within Pitt County, there's no policy of releasing nonviolent offenders or that kind of thing?
Not that I'm aware of, no.
Okay. And then in regards to Pitt County Emergency Management, have any of those departments changed the way that they respond to emergencies or interact with people when they're responding to emergencies?
Yeah, we would always encourage our first responders to approach any sick person with caution and to protect themselves from infectious disease all the time. Dr. Portello, the EMS medical director, has worked with the county dispatch center to implement a pandemic protocol that screens the caller, and if they hit certain positive screenings, then that's dispatched as a potential pandemic call, so that responders take heed. Sometimes the screening doesn't work, so again, I would encourage all first responders to be mindful of it. First responders, myself included as a recovering firefighter, sometimes we end up in the soup before we know what the soup is made of, and I would encourage them all to be mindful of their surroundings and be mindful for this infection and other infections in the field.
And I do want to revisit the question somebody asked earlier about the amount of hospitalizations in Vidant currently with people who are battling COVID-19. I'm not sure if that information is
I'm going to
available.
defer to Mr. Floyd on
Okay.
that. Okay.
Gotcha. Perfect.
And one last question for you, Dr. Silvernail. Have you gotten any comments or backlash on what is considered an essential business? Has anyone said anything about maybe alcohol stores, ABC stores, or places of worship that may or may not, people have different views about that, I guess?
We have had a couple of folks that have sent emails to us regarding concerns about things that are listed as essential businesses that they didn't feel should be essential businesses, and we have crafted an individual response and sent that back to that individual. But I would not feel like we've had a backlash against us. That determination was not made by us. That's a federal determination.
Okay, got it.
All right, thank you very much.
We're going to bring Vine up in just a second to address some of the questions that you had specifically for them. But first, we want to go to the city of Greenville. Their public information officer, Brock Letchworth, I believe, had some prepared statements on their behalf. So Brock, if you want to unmute your.
I think I'm unmuted. You can hear me?
Yes, we can. Please. Yeah. Good.
Yeah, so going back to some of the questions that were just asked about how long these orders stay in place and that type of thing, speaking on behalf of the city of Greenville, I feel pretty comfortable saying these orders are in place as long as they need to be. And the only way that we shorten that time frame is by more people participating in the guidelines that have been provided to them, and only, guidelines regarding social distancing, good hygiene, but also when you're going out to make trips, that it's only for essential activities or essential business, things like going to and from work, picking up food, getting medical supplies, or taking care of someone else, those types of things. Anything else at this point in time can and should wait for the sake of the individual and the community as a whole. I know that this past weekend we had some experience. We had a lot of feedback on some businesses in the area where there were large crowds. And as a result of that, we had our city public safety officials from police, fire, rescue go out, start talking with some of the managers of those businesses to try to educate them on some of the expectations with regards to social distancing and occupancy and that kind of thing. And I think that many of them are taking steps at this time to address some of those issues. We also noticed that social distancing was not necessarily being practiced in some of the public parks and recreational areas that we had kept open in the city. So we've made some changes there. Some of the changes that we've made include we closed River Park North completely. That's including the trails, the water access, the fishing pier there. We closed all our city tennis courts. We closed the fishing pier at the town common. We've also closed our only outdoor basketball court, which is located at Greenfield Terrace in the city. And, we've got several other closures that were already put in place, and you can find all that information on our website, greenvillenc.gov. But I can just tell everyone, we're going to continue to monitor the public participation in these efforts to stop the spread. And it is certainly possible that the city could take additional steps that it deems necessary to ensure the health and safety of the community. It's our goal that, we overcome this as quickly as possible with as many people staying healthy as possible. And with that being said, I think that everybody, whether you're asymptomatic and feeling good and healthy, or you're one of the most vulnerable, that you have the responsibility to take this seriously and do all that you can to limit your exposure and help us flatten the curve.
While he's up here, were there any questions for them? Okay. Thank you for that, Brock. We're going to move on with the questioning. We're going to bring up Vina now to address some of those.
Hey there, this is Madison with WNCT. I wanted to revisit the question that someone had asked earlier about the amount of people that are hospitalized from complications with COVID-19.
Yeah, it's a question we get a lot, and we made a decision for a variety of reasons to make sure we defer the answer on the number of patients in a hospital any one time to the county and to the state. And the reason is so that we don't confuse the public with moving numbers. They change not only every day, but they change during the day for obvious reasons. So I will answer the question only in saying that Vitan Health as a system, and certainly here in Greenville, has experienced patients who need very intensive care for COVID in each of our facilities, except for 2, I believe, at the moment. And so it is something in Eastern North Carolina. The numbers are exponential, as we talked about. And related to the questions that were just asked and pinging off the city statement is, it is so important because we came to the city and county governance to ask for this help, knowing that there is a limited capacity to care across Eastern North Carolina, and that it would also be limited by the wellness of the team members needed to provide that care, whether they are physicians or staff in our facilities. When you consider Greenville as a relatively small community, it's easy to make an assumption about low spread rate. However, the percentage of the community that are Vitan employees is very high and abnormally high, which means spread in Greenville has an exponential, or really in any place in which we have a facility, has an exponential impact, not only to the number of patients infected, but also to the limited capacity we have to care as that curve continues to grow. So as we project it, we're saying it's going to behave as it does in all the other markets. It doesn't care if we're from Greenville or if we're from New York City. It behaves the same way. How we behave, how we choose to act is what will limit and flatten that curve. And we need that to happen so that we have the capacity to render the necessary care in Eastern North Carolina, where we also know we have a vulnerable population, a lot of comorbid conditions that we talk about often, and a lot of elderly who retire into Eastern North Carolina markets. We need to do right by them and social distance and practice incredible hand hygiene and social distancing during this time.
And when you talk about the wellness of your team members, can you give us any kind of update or window into the supply situation when it comes to masks or protective gear for dealing with these cases?
So those are also fluid things that do depend obviously on our utilization and our need to utilize them, how the public, numbers look and all of that. So I only say that we are utilizing masks inside of our facilities. Whether you are a visitor, whether you're a patient, or whether you're a team member, all of our team members are wearing masks inside of our facilities, and that is to practice the extreme level of caution for all the reasons I just stated earlier. And we are confident that both if we are able to flatten the curve, we have supply to manage this, with also replenishment coming into the facility, with our ability to reuse, recycle, and sterilize these instruments, and the public that has been so gracious to help us along the way with masks that they have been able to acquire, shields that we are developing, and the like. So when you put all of that, we have a level of confidence that we can do what we need to do now, because what's most important is not trying to manage the supply lines when the curve has become overwhelming. It's about, can you prevent the curve from ever becoming overwhelming?
Absolutely. And then my last question for you is, the sterilization and reuse of masks and other protective gear has been, I would say, controversial in other hospitals across the nation. Of course, they're dealing with higher volumes than we are. Any comment as to, is Vidant reusing or sterilizing masks and those kinds of things and using them over again, or what are you guys kind of doing?
So we have a variety of ways in which we plan for pandemic such as this and how we manage our supply lines. We have an inventory that we use to manage on a day-to-day basis for PPE. We have additional supply lines that we have in reserve. We then have access to state supply lines, and then we have access to a national stockpile. We anticipate that's all that we're going to be using related to our PPE. And we have guidelines internally about using a mask all day and then preserving the use of your N95s for only the cases, as Dr. Silvernail just mentioned, that require aerosolized protection. So if those guidelines are used, we use our regular supply of PPE. When we talk about the recycling or decontamination process to sterilize masks for reuse later, it is to put us in a situation where we have some back reserve after, if we had to go through those other stages, that we have some reserve capacity, which we know is safe, which we are using. We're in the process right now of putting those in place, and we test them and ensure that they're sterilized and that kind of thing. So we're confident in that process, and it's being used in hospitals now, of course, across the state as well. But those would be reserved for the last resort if we needed them later.
Thank you. So how many beds do you have at Vidant for COVID patients?
So, well, Vidant is a large system with a lot of beds. Obviously, any one of those beds could become COVID patient beds.
Specifically in Pitt County, I mean,
In Pitt
sorry.
County specifically, okay, Vidant Medical Center. So we have 907 beds in the facility. We have cohorted a number of beds that we use for managing the COVID population. That depends not on the beds themselves. It just depends on how many patients we need to cohort together. And so the number of beds for COVID patients is relative to the number of patients we have with COVID.
Okay. And are you expecting the number of COVID patients to surpass the amount of beds you have?
Again, I can't emphasize enough that we have 907 beds. We have limited supplies of all the things necessary to take care of patients with this. And do we expect it to surpass? Not if the public does what we're asking the public to do in extreme vigilance. That is the whole reason social distancing and the policies we've been talking about here today are so important, so we don't get to a situation where we exceed our capacity. We have contingency plans for escalating if we need it beyond what we have the capability to offer. We have contingency plans to help us manage that. But obviously, the best thing for everyone is to help us not have to get to that level.
And what are those contingency plans?
I'd rather not go into that here today on a press conference, but just suffice it to say that how we organize our system, how we organize the use of our ventilators, how we organize cohorting patients, and even if we needed exterior resources like other facilities to cohort patients into, we just have escalation plans to get to that.
Okay.
With COVID-19 being so easily transmissible, how many negative pressure rooms do you have at Vidant Medical Center, that facility, and then on top of that across Eastern North Carolina?
Oh, I don't remember the exact number of negative pressure rooms that we have. We have several ways in which we're doing negative pressure. So there are permanent fixtured negative pressure rooms on each of the wings of our facility inside Vidant Medical Center. So if you have a floor, they're on each ends of the floor. There are isolation rooms. We also use HEPA filters inside the facility to create a version of negative pressure and cleaning and scrubbing for those rooms. So it moves again according to the needs of the patient, but I can't remember the exact number of our negative pressure fixture rooms. Yeah. So there's 100 isolation rooms, which all are negative pressure, but there are other negative pressure rooms for other procedural things and the like that we might be doing.
So as far as the hospitalizations, I know we had 2 at the last press conference or news conference. As far as the capacity there, I mean, can you give us kind of a percentage of the availability as far as the rooms here in Greenville?
I'm not sure I understand exactly what you're asking me.
I know that I don't know if you're using those isolation chambers, I guess 100 that you just mentioned, as far as the capacity that's available of those isolation rooms are right now.
We still have capacity for more use of isolation rooms. And we don't just use isolation rooms just for COVID patients. Another reason why we are stressing this issue so heavily is of social distancing and the like is, the hospital runs a census without COVID patients already. It's a very large hospital because of a very large burden of disease in Eastern North Carolina. So even with a reduction of elective surgeries and procedures, hospital still has a high census number. And so we use rooms like these for a variety of different purposes beyond COVID. We still have additional rooms that we can use for COVID patients based on where our census is right now. But obviously we are anticipating at the rate we're seeing it, it continues to exponentially increase. And so, it's really important that we practice the ways to prevent continued spread.
Earlier, you mentioned that you see kind of the peaking happening in late April. As far as once it peaks, how long do you still think it's going to take for it kind of this to really clear out essentially?
I wish I knew the answer for that. I don't. As Dr. Silvernail mentioned, managing pandemic like this, there's so many variables to that. And the length of the incubation periods and how long it continues to recycle is how long you stay in a state like this. And so I think it was said earlier by the city, Brock, who made the comment, and he's absolutely right about this. The public's desire and all of our desire to not be in this situation long is dependent specifically on how the public limits its spread from one person to the next. And the way that happens isn't medication and the like. It is social distancing to allow the incubation period to pass without continuing the spread, because when you spread it to the next person, you've just lengthened the incubation period again. So it's really, really important that we practice these principles and take it seriously.
And earlier in your remarks, you mentioned where you haven't seen people practicing social distancing like they should. Can you kind of pinpoint some of those general areas and maybe kind of send a message of where people should be practicing, where maybe they don't understand that they are not doing it correctly?
Well, I don't want to mention either any specific facility or place. We certainly see it in large store, big box retail, where people are going in together. I get calls from community members who are concerned about it. And so all I can do is convey back to the public that it's incumbent upon us to not only help ourselves, but to help someone else when you see the lack of social distancing. And I find most people are receptive to that. They know you're doing it for their well-being. But we all have to help each other avoid our natural tendencies to aggregate together and practice that social distancing and helping each other. But it's in a lot of different places. And as the city mentioned, they are intervening, but it's the best intervention would be for all of us to practice it together.
And in our previous news conference, you mentioned that you are making it optional for your employees to wear a mask. Has that changed?
That has changed. We now no longer allow it to be optional. Our reason and rationale for that is, one, we spent a lot of time ensuring our pandemic supply lines and how long we have PPE for before we made it mandatory. But we also know the CDC guidelines are clear that if you can, the best way to minimize the spread is to provide for the masks. So it's not necessary, it's not essential for it, but obviously in nearly 1,000 bed hospital environment and all of our hospitals where you're going to have sick patients with this, we know it's the best practice for us. And again, I can't stress enough that we are trying to make sure we keep our team members well.
And what other precautions and safety measures are you taking for your team members, especially with those who have underlying conditions?
Well, we weeks ago made a decision to minimize the number of people that are here that don't have to be here. If they can work remotely, the first thing is to reduce the number of people in a facility. The second thing is we began social distancing training and preparation weeks ago as well. Hand hygiene is critical, so we make sure we have plenty of hand hygiene dispensers, almost everywhere within the facility for people to have quick use. And then, of course, the masks themselves provide not only a level of protection, not from patient to the caregiver entirely, but from caregivers to each other. It's also allergy season. There's pollen in the air and people are sneezing for a variety of different reasons. And we don't always know which one of those people is incubating COVID. So the only way we can manage that is to do the best we can to prevent the spread, which is to use the masks. And so we find the behavior also when people are wearing them, they do tend to be more aware of social distancing when they have a mask on. So there's a lot of reasons for it, but it works together, we think, to help provide the best results we can.
Certainly, and as Vidant is a high risk area for potentially getting the virus and making all of your employees wear a mask, I didn't know if you had any thoughts or comments on the potential recommendation yesterday out of the White House that all Americans may in the future wear masks. Do you have any thoughts on that?
I'll just stick with the statement that the CDC had previously released the guidelines that if you can, the best thing to do in a time like this is to wear them. And we see other countries where there is the use of masks, there has been a slowing of the curve, right? So we see in other markets that we can learn from what works well. In some places, it's easier than others to control that. You have less density or you have more control of public behavior. And so I can't comment on the White House recommendation on that entirely.
And as far as your contingency plan, I didn't know if y'all have been previously in talks with the National Guard or any other government agency just to prepare for down the road if it, after the peaking or towards the peaking of this.
Obviously, Vitan Health is a very large part of disaster command for Eastern North Carolina, especially with the facility here in Greenville. So we are regularly in discussions with state and federal agencies that help support communities in a time like this in a region. So yes, we have disaster command procedures and protocols that do escalate should that be necessary. We're not in them today for any reason. We find the public to be helpful. And for the most part, especially what we're experiencing in our facility, our people recognize we are protecting everyone with the behaviors that we're doing. And so the hardest thing I think we've had to do is visitation policy change, where, if I had my druthers, I would never want a family member not to be with their loved one in the hospital. But we know to protect everyone, it's necessary. And we know that people are experiencing a hardship from that, and it's difficult. And at the same time, something that they know helps keep their loved one well and is the right thing to do. So we're making very difficult decisions to the otherwise way we would love to operate our facilities. But we're making those extreme decisions out of a sense of concern for the extreme pandemic response if we don't do this well.
And just to wrap things up, have any VITA employees been tested or have tested positive for COVID-19?
Yeah, I don't like to talk about employee matters, in public space like this, other than to say that obviously they are citizens, and when exposed, we test, and there are some that have tested, which I would expect will continue as we go through this. They're a large part of the community as well.
Sure, thank you.
Thanks.
Any other questions for any of the other organizations represented here today? Again, we have county management, emergency management, Pitt County Schools, Pitt Community College. We're good. Okay.
Can we talk to Pitt Community College?
Sure.
Hello.
Hi. So I was wondering about the employee at Pitt Community College, if I heard that correctly, and kind of the time frame of this, and when he was on campus, he or she.
So they were on campus last week for a brief time period. And that's what we went back through the security footage and kind of tracked back the time frame that she may have been exposed. And then that's when we started notifying individuals in that time frame.
Okay. Do you know how many people he was in contact with? Was it other employees? And they've been told, you said?
In employees only, and I don't have an exact count. It was less than 10.
Okay. And do you know if they went anywhere else other than campus and to their work?
I do not. I know that it was mentioned that they had been adhering to the isolation protocol. So if it was anything, I imagine it would be minimal.
All right. And you said you found out Monday. Is that the day that they got the results back?
We were notified shortly after they got the results. I'm not sure of the exact timeline on that one.
Okay. And do we know if they had traveled anywhere?
I do not know that one.
Okay. And is there any other information that we do know about this situation with this employee?
Not that I'm giving out.
All right. Okay. Well, thank you.
Mm-hmm.
And I just have one question real quick. So I guess, not knowing travel history, do you know if it was a community spread case or no, like?
I hadn't really gone and visited the person to find out what they were doing.
Okay. All right. Dr. Silvernail, do you have any info, or is that kind of, you don't know the occupation? Yeah. Okay. Gotcha. Yeah.
All right, thank you.
Any other questions for any of the other organizations present? Okay, if not, just a couple of quick follow-up items. If you are in need of food during this time, we also can encourage you to look at the Pitt County Food Finder app. That is a product of the Pitt County Farm and Food Council. You can go on the Play Store or Apple as well and find that. That's the Pitt County Food Finder app. Search for that and you can find it there. Also, all the information presented is going to be available on our website at pittcountync.gov/coronavirus or available in Spanish at pittcountync.gov/coronavirus-es. And if you are doing any social media messaging on your own to help encourage your neighbors and your family, we ask that you use the hashtag #GoHomeStayHome, as that is what is heavily being encouraged today. The next media session is scheduled for Thursday, also at 11:30 a.m. Again, and thank you all for coming today.
Thank you.